Okay, everybody, this podcast is going to be about the intrinsic conduction system, which is kind of just a fancy name for the electrical circuit within the heart. I would suggest that you have your notes split screened with this Ed puzzle so you can follow along with your own notes with this video. Okay, so the intrinsic conduction system is the system that sets the rhythm of your heartbeat. This set of tissues is special and it's found nowhere else in the body, so it really only exists in the heart. It causes the heart muscle to depolarize only in one direction, so it always is going from atriums to ventricles. So it's always going in that one direction. And then it causes a contraction rate of about 75 beats per minute. Obviously, that's just an average. Everybody's a little different. Okay, there are kind of four main parts of the intrinsic conduction system within the heart. So we will go through them now and kind of color code them as we go. Just to be clear though, when you're looking at a heart, these are not things you can physically see. These are just specialized tissues within the muscle of the heart and within the atriums of the heart and within the tissues of the heart. So these aren't something that we could see with our eyes. Okay, so the SA node is located right at the right atrium. So in your image, you can see the SA node right here. It's a bundle of tissues, and its job is to start each heartbeat and actually set the pace of the heart. So this is why this particular part of the intrinsic conduction system is called the pacemaker. Okay, and the job of the SA node when it fires, when it sends its signal, when it starts to depolarize, it causes the atrium to contract. Okay, next we have the AV node. So the signal is going to travel from the SA node to the AV node. So that is a bundle of specialized tissues, and it's located right at the junction of the atria and the ventricles. So you can see right there, right by the atrium and the ventricles. So the signal starts at the SA node and then travels to the AV node. Now it's going to go down the bundle of His and through the bundle branches. So the bundle of His and the bundle branches, there's the bundle of His, and then the bundle branches kind of continue down the septum. Next, you have the Purkinje fibers. The Purkinje fibers are located in the myocardial walls of the heart. So here are the Purkinje fibers, and you can see that they start kind of at the apex of the heart and go up both muscular walls of the heart. And when the Purkinje fibers fire and the signal goes through them, that is when the ventricles will contract. So again, signal starts at the SA node, travels to the AV node. If we wanted to number them, we could. So SA node would be 1, then it travels to the AV node, through the bundle of His and the bundle branches, and then through the Purkinje fibers. And the contraction occurs at the atria when the SA node fires. And then the contraction occurs at the ventricles when the Purkinje fibers get the signal. Okay, if we were in class right now, I would definitely watch this crash course video because this is one of those things that it really helps to see it moving. So please stop the Ed puzzle now and go watch this crash course video. Okay, when a person goes to the doctor to get their intrinsic conduction system checked out, maybe they're having some heart palpitations, or maybe their heart's beating too fast or too little, or it might just be a general checkup. A lot of times what they have done is an electrocardiogram. You might have heard this called an ECG or an EKG, but that stands for electrocardiogram. And you can see in the image that is what an EKG looks like. It's kind of a series of waves. And what you're looking at there is kind of just three parts. So the P wave is what you're going to see when, it's right here, when the SA node fires. So that moment of depolarization at the SA node is going to cause just a little bit of a wave in the EKG. Next, you have the QRS wave. The QRS wave is going to be the bigger wave that you see right in the middle of the EKG, and that is the depolarization right before the ventricles contract. Okay, and then the last part of the EKG is known as the T wave. It's located right there, and that is when the ventricles are repolarizing before the whole cycle starts again. So if we were to see a full EKG, this would be done, for many more seconds than what you see in this graph. You would just see this pattern repeated over and over and over again. And what they're looking for to see if the size of the waves are normal, if the spacing between them is the right pace, so they can determine a lot of things about the electrical circuit of the heart by using one of these EKGs. So let's say a person gets an EKG because there's some suspected heart issues, and maybe they have a slow heart rate or a fast heart rate, or the heart rate is just irregular. These are some things, some homeostatic imbalances that can be happening within the heart that is causing these electrical circuit issues. So the first one is any kind of damage to the SA node. Damage to the SA node can result in a slower heartbeat. So if they get an EKG and the heartbeat is really, really abnormally slow, it could be something wrong to the SA node. And this can actually happen because of just aging. A person's getting older and or heart disease. And if this happens, this is what an artificial pacemaker would be used for, because remember, the SA node starts the whole intrinsic conduction pathway. So if that one doesn't actually go and do its signal, then we need to put an artificial pacemaker in to kind of keep the regular beat of the heart. Another issue, another homeostatic imbalance would be something called ischemia, and that is just a lack of blood supply to the heart. This could lead to something called fibrillation. Fibrillation is kind of like the shuddering of the heart muscle. So it's a very uncoordinated, rapid beating of the heart. So the ventricles or the atrium kind of just shudder instead of doing a smooth fluid contraction. This can happen because of coronary artery disease. So the blood supply to the heart is not getting through, and the heart muscle itself is not getting enough oxygen. So that's when ischemia could happen and when the heart starts to fibrillate. Other things that can be seen on an EKG are rapid heartbeat and slow heartbeat. So that tachycardia is a rapid heart rate over 100 beats per minute, and bradycardia is a slower than normal heartbeat under about 60 beats per minute. So there's lots of different causes of each of these. For tachycardia, it could be heart disease, could just be congenital. You could have something going on with your thyroid. It could be temporary and just have a fever or caffeine. Drugs can cause tachycardia. If it's temporary, it's usually not a problem. If it's prolonged tachycardia, it's always happening. It could lead to that fibrillation we talked about, that shuddering of the heart muscle, which could lead to a heart attack. Bradycardia is slow heartbeat. That could be due to aging, damages to the heart. Could be an infection, also something with your thyroid. Could be some kind of imbalance of potassium or calcium, inflammatory disease, sleep apnea, and other things as well. So these are two different things. If you look at the images down at the bottom, you can see kind of the difference. This is a normal rhythm heart. Okay, so you see 1, 2, 3 beats in this time period. Look at bradycardia, only much slower, and then tachycardia, lots of beats. All right, going back to that fibrillation again, you can have either VFib or AFib. VFib stands for ventricle fibrillation, so that's when the ventricles are shuddering. So they're the ones that aren't contracting smoothly. If VFib happens, this could be a life or death situation. It can cause cardiac arrest because if you think about the purpose of the ventricles, it's to send blood to your whole body. So if the ventricles aren't working properly, that could result in cardiac arrest. So this could be caused, VFib, when the ventricles start shutting, could be caused from a heart attack. It could be abnormal electrical impulses, tachycardia. Really, the only treatment for VFib or cardiac arrest is an AED to electrically reestablish the heartbeat. And Miss Melzer is actually going to come to us next week and talk to us a little bit about AEDs and just how they're used. Okay, there's also AFib. AFib is when the atriums are shuddering. This can happen for short periods of time. So somebody can have a brief period of AFib, or somebody can actually have AFib all the time. By itself, AFib is not life-threatening like VFib is. It can, however, form clots in the little atrial appendages that you saw on the heart yesterday. They're those little like flaps on the outside of the heart. And that can be bad because the clot can obviously start to travel, could lead to a stroke. So that would not be good. There are procedures that can be done to try to prevent those clots from forming, like blood thinners. Causes can be high blood pressure, heart attacks, heart valve problems, coronary artery disease, viral infections, and other things as well. Okay, and then a homeostatic imbalance that you probably hear about fairly often, but maybe just didn't necessarily know what it meant, is congestive heart failure. So if somebody says that somebody's having congestive heart failure, what that means is that the pumping of the heart is just no longer working as efficiently as it was before. So circulation of the body is inadequate to meet the needs of the tissues. This is a progressive condition, which means it continually, slowly gets worse and worse. And there's many causes for it. Some causes could be coronary arteriosclerosis, which is when the coronary vessels are clogged. It could be prolonged high blood pressure. Could be multiple heart attacks. It could also just be due to age as well, which maybe we should have wrote in. And depending on what side of the heart is experiencing heart failure, if it's both sides, if it's more one than the other, could mean what symptoms the patient is experiencing. So if it's on the left side of the heart, blood could be pooling into the lungs. And if it's on the right side of the heart, the systemic circulation of our body could back up. And one of the first signs could be swelling or edema of the limbs of the body. And these are just kind of the stages of congestive heart failure. Again, we said it was progressive. So, you start at stage 1, depending on the person, that might last a long time or a little time. And then you kind of progress in seriousness as it gets worse. Hi, guys. Thank you so much for listening to this podcast on the intrinsic conduction system. I'll remind you, Quizlet is a great resource. So going to Quizlet now and practicing a little bit with the terms we just learned about would be a great idea. Also, don't forget to watch that crash course in the beginning of the notes. It's also very helpful. Bye.